Good afternoon.
Hello.
Hi, I am Nurse Calorie. I'm here to talk about your type 2 diabetes. Can I verify your name and date of birth?
Charlie Smith, August 31st, 1950.
Okay, awesome. That's what I have here. So, to start, do you have any questions about diabetes?
So, what is type 2 diabetes? Can you explain that to us?
So, type 2 diabetes, it is both a resistance of insulin, so your body is making insulin, like your pancreas makes insulin, but it can't use it. Your body is resistant to it, and usually it has something to do with higher levels of fat in your bloodstream. So obesity is one of the main risk factors. But yeah, essentially your body can make insulin and it just can't use it. So the sugar's there, but you just can't use it.
What
That's
is insulin? What does insulin do?
Insulin, it helps get glucose into the cell.
What's glucose?
Glucose is sugar, and you need sugar in order to function.
Oh,
Well, let's go over I have a couple questions I'd like to ask you, and we'll get down to the bottom of this. So, why don't you go ahead and tell me, have you had any recent changes in your weight?
I don't think so.
No. What about changes in your vision?
Yeah, I guess things have been a little blurry recently.
Okay. Have you had any changes in your appetite or thirst?
Yeah, I've been really hungry and really thirsty recently.
Okay. And then, what about, do you feel like you've been taking more frequent trips to the bathroom?
Yeah, but I thought that was just a part of getting older.
That's fair. I understand. Do you drink alcohol or use any substances?
Yeah, I drink.
You drink. Okay. How often?
Oh, a couple times a week.
A couple times a week. And how many drinks do you have a day?
Oh, when I'm drinking, probably 4 or 5.
4 or 5 drinks. All right. Have you had any recent or recurrent infections or wounds that aren't healing?
Don't lie. He has this thing on his foot that won't go away.
Okay, we'll take a look at that in a minute, all right? Do you smoke or vape?
Oh, sometimes.
Sometimes. Well, how often?
Oh,
Be honest.
a couple of cigarettes a day.
A couple cigarettes. If you had to say how many packs a day would you have?
Half a pack.
Okay.
1 pack.
1 pack a day. All right. And then have you ever tried to quit?
Nope.
Do you want to quit?
Not really.
All right. What's your diet like?
Fine.
What's his diet like?
We go to McDonald's a lot.
McDonald's. Okay.
Fast, easy food.
That's
He
nice.
eats whatever he wants.
Okay. And what are your exercise habits like
I don't exercise.
at all? Do you feel like you live an active lifestyle at all?
I walk around my house.
All right. Well, the labs that you had drawn, they are indicating type 2 diabetes. So the concerning labs, starting with your A1C, is essentially it's a measure of what your average daily glucose levels were over 90 days. And so yours was 10% and normal is between 4 and 6%. So essentially anything over 6 tells us you have diabetes. You've also had 3 fasting blood glucoses that were greater than 150. Your urinalysis, which is, you peed in a cup when you got here, shows that your dipstick glucose test was positive for glucose in your urine, and that's an abnormal finding. You shouldn't find glucose in your urine. And then we also did a lipid panel because I noticed you had a medical history of high lipids, so hyperlipidemia. So that's one of the risk factors for diabetes, and it's actually going to complicate some things for you in the future if we don't stay on top of it. And then diabetes is really hard on your kidneys, so we also got a baseline kidney function lab, which both looked good for now. But today when you came in, your fasting blood glucose level was 300, so we really want to work on getting that down. Do you guys have any questions for me so far?
So he's gonna have to give himself those insulin shots now?
No, not at this point. So since he's just being diagnosed with this, I'd really like to stress some lifestyle modification. So I know you said you eat McDonald's pretty often. I know you said you eat it pretty much every day. Why don't we try to get that down to once a week? And you need to try to incorporate some high fiber into your diet, eat some fresh fruits and vegetables, really work at home, I'd like to get you a referral to a dietitian to go over a meal plan with you. What other questions do you have?
I think I'm okay.
You think you're okay? All right, well, I would like to go over some things I want you to go home and think about. So, with diabetes, you can have high blood sugar or you can have low blood sugar. So since we're starting with diet and exercise changes, you more want to focus on hyperglycemia. So if you had hyperglycemia, you would have, like you came in today, you'd be really thirsty, you're gonna have blurry vision, you'll be very hungry. You might notice a fruity smell on your breath, you might be nauseous, and you might be peeing a lot, just like you were today. I want you to take this home with you and hang it on your fridge, so then when you start feeling funny, if you look at this and notice you're having those symptoms, you know you're having an episode of hyperglycemia. Yeah, so when you're sick, it's really important that you continue to check your blood glucose. Right now, you're not really going to be on medication, so you don't have to worry about it, but you're going to keep taking your medications as directed because infections cause high blood sugar. And you're going to eat a diet with carbs. Don't cut carbs from your diet, and increase your fluid intake because you want to prevent dehydration. We'll get you a referral for a podiatrist to get your toenails cut and help keep up on your foot hygiene. All right? So, otherwise, I really want you to make sure you're getting your regular eye exams and come for your follow-up labs so we can monitor your kidneys and your A1C to see if your diet and exercise have been helpful in lowering this. And we will see you in 6 months, okay? All right, good to see ya. How's everything been going with your diabetes?
Well, it's been going okay.
He's lying. He hasn't done anything that you've asked him to, and that's why we're back.
Okay, you want to tell me more about that?
Well, you told him no McDonald's, and he's still going to McDonald's probably 2-3 times a week. I'm trying to get him to exercise with me, but he's complaining that he's too weak. He doesn't want to. The ulcer on his foot has gotten a lot worse. He's not checking the temperature in his bath water. He's not wearing properly fitted shoes. He definitely did not stop smoking. He tried. It just wasn't working out for him, so he's still smoking.
Okay.
We haven't talked to a dietitian. We haven't got to an eye doctor, so
All right,
really
Grandpa
no
Charlie.
progress.
What's going on? Why aren't you, what's going on that you can't change what's going on here?
Don't want to.
You don't want to? I understand. I feel like it's hard to live your whole life and live life the way you are and then have someone tell you you need to make all these changes. Is there one thing that you would be willing to change out of all of the things? Is there one thing? Otherwise, we're going to have to cut your foot off.
And you're gonna have to start giving yourself shots every day, and you don't want to do that.
Well, when you say that, I guess I could try to start walking a little bit more, get a little more active.
Okay, so you're willing to do some exercise.
Yeah.
So the guidelines is you should be getting, I believe, 120 minutes a week. But if you could do, let's say, how about 15 minutes 3 times a week? You just go for a walk outside. Do you
He
think?
likes working in his garden too. Would that be part of exercise?
Yeah, that would be great. The big thing there is you want to prevent injury, because again, you have a delay in healing for wounds and a higher risk for infection. So the big thing today is the doctor wants to get you started on a prescription for metformin. It is a medication that'll help lower your blood sugar after you eat. And then he also has a referral for a podiatrist to get your foot looked at. We still have a referral for a dietitian. So we're gonna make those appointments today, and I'd like you to make sure you go to those appointments. And we'll also run some follow-up labs because it looks like your A1C is up to 11% now, and so we'd really like to have that come down to about 7%. So what questions do you guys have about this new medication?
So it's not a shot, right?
So if this medication doesn't work, we're gonna have to consider insulin to better control your hyperglycemia. But this medication, you take it, I believe 2 to 3 times a day. I think I'm wrong on that. you can cut this part out of the video.
2 times.
Wait. You're gonna
So
take it.
recycle.
You're gonna take it twice a day, and you're gonna take it with food because it's gonna cause some gastric upset, some nausea, vomiting, maybe diarrhea. That's gonna go away with time. That's expected. You don't want to double doses. Make sure you take if you miss a dose, take the next missed dose as soon as you remember, unless it's time for your next dose. And the big thing with this one is you want to make sure you let your healthcare provider know before a procedure, especially if it involves contrast dye, because metformin's really hard on your kidneys. Diabetes is hard on your kidneys, and so if you get that contrast dye, which is also very hard on your kidneys, you have a risk of putting yourself into kidney failure pretty early, and we don't want that. You really want to look for signs of lactic acidosis, which the main one is muscle pain. So if you have muscle pain, call your provider immediately. That's really it for the medication. Just make sure you're taking it with meals. Don't double doses. Don't try not to skip doses. You need to make sure you're getting your regular follow-up exams for your labs to monitor your kidney function. You want to monitor your eyes. Go to the optometrist. Again, we're going to make that appointment today. We're going to make the appointment to the podiatrist today. And then I have handouts here for you. Sick day guidelines. Hang it on your fridge. That way, anytime you don't feel good, you know exactly what to do. And I know you're already having issues with foot care, so I have a handout for you. Hang it on your fridge. Diabetic foot care. All right? And you're going to go to the podiatrist. I'm going to go ahead and write down his name and give you the date there. All right? Do you guys have any questions for me?
So I can't wear my sandals anymore?
No more sandals. You need to get well-fitted shoes. The podiatrist is going to help you get fitted for those. Make sure you're washing your feet, clean, dry socks, white socks. So if you end up with any other wounds, you'll know, okay? That's the big thing right now. Any
So
questions?
just take his medicine,
Yes.
exercise,
Yes.
check his feet.
Even if you're sick, make sure you're taking your medication because your blood sugar when you're sick goes up. And make sure you call your doctor too if you're sick, because sometimes they will give you an order for insulin if you're not able to manage your hyperglycemia without it. Okay? All right. Well, that's all I have for you guys today. Good luck, Grandpa Charlie. We will see you in 3 months.
Thank you.
Thank you.